with physician burnout, I think the first thing to understand is, it's sort of inevitable at a point. I think that telemedicine puts a an added layer for those who are not used to it to add to frustration, right? So, physician burnout, I think the last paper that I was reading about it said that about 50% of, providers, have some sort of, burnout that they report. So if you're going to take somebody who's already burned out, right, who's having those sensations, having those feelings, and you're throwing them in the deep end of telemedicine, obviously there's going to be a lot of frustration there, in terms of how to navigate, this new modality, which, obviously it's so new for a lot of these providers that, they haven't even had the chance to go through this in their training, in their medical training or, other types of, taxonomy training, for example. So, some of the, frustrations that can lead to burnout related to telemedicine for me and my experience with our providers nationwide is really just breaking the ice, right? So how do they apply it? That's really where it needs to click for doctors to really see the correlation between how it can get really leveraged in their practice. For example, with us, what we do is we deliver a program alongside of an ability for the doctor to leverage telemedicine for their own patients. So for example, if they have something to package it around, so for us, it's health coaching, for example, could be any other program. If they have something to package the telemedicine around where patients are getting used to it, COVID sort of being another reason why people are getting packaged into this now, it creates a better atmosphere for the adoption, for providers. So, in terms of frustration, it has to do with technology is number one. So if they can get a technology that's usable, that is something that really fits into their workflow, for example, EMRs. So more and more EMRs are now coming out with or have the ability to conduct telemedicine visits. So if they are in the environment that they're used to, they're much more likely to adopt it and not, relate to big frustration, which is the technology component, right? The same thing goes for patients, and on the patient user experience side. If they're using a patient portal already for that doctor, they're already, involved in sort of the technology pieces that the office is providing. By adding in another layer of the patient portal that may have a telemedicine arm isn't so foreign for patients. So I would say, my overall response would be the frustration is related to the technology and the usability of the technology for that provider. So if they can overcome that hurdle with a program offering or with a technology that's integrated with their EMR, it's much easier for them to integrate it into their already busy work schedule.
So I think those that have had positive experiences, number one, they have workflows that have been really customized or well thought out of per their specialty or per their vendor of choice. So I think it's the thoughtful workflow and the technology to support that. I also think usually it's the savvier super champion doc that's really nailed some of those things and created a lot of those workflows, created a lot of those custom templates. So again, taking work, and again, my mindset is on the EHR. I think there are many examples outside of the EHR that can be assets, but for now, just kind of keep it in that EHR lane. That's what comes to mind.
There, there are segments of the population that either have trouble using technology because of their age. There are some who don't have the equipment because of their socioeconomic status or where they live. So those are probably the biggest problems.
Yeah.
And the only way to help with that is to improve internet availability for all socioeconomic classes, but some people may still not be able to afford the technology.
Right.
It's bigger than just a simple answer because it speaks to disparities in care and poverty and things like that.
Yeah.